Good afternoon and hello, everybody. I am Dr. Gayatri Ghadiok and I will be your host and moderator for today's session. A little bit about myself. I'm a graduate from the Christian Medical College, Ludhiana, and did my MD in pathology from Maulana Azad Medical College, New Delhi. I specialized in hematology and histopathology and worked with several top corporate hospitals in New Delhi before I switched to medical operations and management as part of the founding team and medical director for Fortis La Femme, Delhi, the first comprehensive facility for women's healthcare in the country. I've also been the director of operations for Nova EV Fertility, where I established and operationalized 5 IVF centers in India. I went on to joining the World Health Organization, where I focused on public health, program development, and quality assurance in the Asia Pacific region. A few years ago, I also joined hands with the Ministry of Health Kerala government to establish systems for quality blood transfusion services there. In addition to healthcare, I am also the chairperson of an NGO called Rohini Ghadiok Foundation that works in the field of education and providing for underserved and marginalized children. Given my work and areas of interest, I am particularly pleased to be collaborating with health travelers worldwide for this series of talks with experts and medical professionals to discuss relevant issues that we are faced with at this time. I am joined today by Dr. Wasim. I would like to introduce Health Travelers Worldwide, an independent health advisory guiding patients through multiple treatment options available to them and helping them find the right and the top doctors in India. Their tagline is "Let's get better," and they have helped more than 7,000 satisfied patients getting the right diagnosis and care. Their services include handling of complex and critical cases and providing health assistance and airlift emergencies. I have the pleasure to introduce today's speaker, Dr. Wasim. He is an allopathic doctor with postgraduate degrees in both Ayurveda and acupuncture. He is a trained family physician with the MRCGP from the Royal College London and has specialized in preventive and wellness medicine. Dr. Wasim brings a holistic perspective to wellness with a focus on risk analysis, sleep medicine, sexual health, smoking, de-addiction, and healthy living. He is also an alumnus of the Massachusetts Institute of Technology, popularly known as MIT in Boston, with a passion for healthcare technology and has worked across India, Sri Lanka, and Africa to bring healthcare to the masses. Today, we will be discussing how to maintain wellness and well-being during the lockdown. Before we start the session, let me add, if there are any questions, please share them with us in the comment section. We will try to take as many as possible towards the end of the discussion. Dr. Wasim, I invite you now to begin with your talk and presentation of how we can maintain our wellness and well-being during these times.
Thank you, ma'am. Thank you for that rather generous introduction. I could start with a little presentation on a common question is, what is wellness? Before we understand what we can do during the lockdown and after the lockdown, a lot of times I keep getting asked, Doctor, what is wellness? When do people actually need to come to a wellness physician? Are we overdoing it? So I thought I'll give a primer on what wellness is all about. So can we have the first slide, please?
Okay, I think while we get over, there she is.
Yeah, next slide. The next, you can skip the first two. That's me. That's just who I am. Okay, so this is something that I want to highlight about how India over the last few years has suddenly taken up a huge part of uh, a, a huge liking to wellness. If you see in 2007 and 2015 and even up to 2018, India formed a very small part of the world's wellness market, if you can say that. There were much fewer people. It was extremely niche. But between 2018 and 20, it appears that a lot more Indians have taken to wellness. A lot more people have understood what wellness is, and therefore the need and requirement for a wellness doctor has actually gone up in the last couple of years. Next slide, please. So, what is health? So, World Health Organization, and Dr. Gayatri would agree, defines health as complete physical, mental, and social well-being, and not just the absence of disease or infirmity. If you add wellness to that, then we add a few more dimensions to health. Besides physical, mental, and social, we also look at emotional well-being, ethical well-being, and over the last couple of years, things like financial well-being, sleep, and all of this have been added to the dimension of health. So it's no longer just physical, mental, and social, but emotional well-being is also a large part of wellness. And this is probably where there's a slight difference between being healthy and being well comes into play. Next slide, please. So this is probably the best way I can explain what wellness is. Most of us are in a state of discomfort. We fall sick when we do, and we go to our doctors who treat us, who treat the sickness and illness, and take us and put us back into the state of discomfort. This journey from this discomfort to wellness is the journey that wellness is all about. So when you fall sick, you do go to the doctor. And most of us, including me, when I was not a wellness physician, I used to treat you and put you back into discomfort. What is this discomfort? Next slide, please. Invariably, you may not have all of them, but even if you have one or two, then we're all in the state of discomfort. You might need smoking. You might be struggling to give up smoking. You might be overweight. You might have difficulty with sleep, with bowel, stress, which is normally very good. It is a kind of a motivator, becomes a problem. Sexual issues become an issue. People fall sick more often than not. They feel bloated, they feel sluggish. These are all problems of being in discomfort. Now, you're not sick enough to go and get treated, but you're not well enough to perform at your best. And this is that state of discomfort that I told you about. How do we go from this discomfort into wellness? Then what is wellness? Next slide, please. Is when you don't need smoking. You don't have to worry about your weight control. When I say worry about weight control, if you eat sweets for Diwali, for example, you don't have to run 2 extra hours in the treadmill. A body that is well will take care of it by itself. You don't have to do something extra in order to burn off the extra calories that you ate. Your body will take care of it. Stress then becomes something that's a motivator than weighing on you. You have a clear stomach, you're a lot more active than you are, your sleep is peaceful, sexual issues are not an issue. This is the state of wellness that we talk about. And these are some of the common areas that I've taken. There are a lot more areas that most of us can be in discomfort. Next. Who is affected? Most people say that everybody is affected. I listed about 9 issues that you might face. But I believe there are a lot more issues that put most of us into states of discomfort, which means that most of us have 1 or 2 or 3 or many of those discomfort areas, and we want to move into the area of wellness. And that's the journey of between discomfort and wellness that I'm trying to give a primer to today. Next. And this is something one of my professors told me, is that to get back to good health, you must be sick and tired of being sick and tired. If you are not aware of it, this is not going to work. If you're not aware that smoking is creating troubles later, this is not going to work. If you believe that, oh, I'm always stressed, my work is a problem, everything else is a problem, you're not going to take that first step into wellness. Once you realize that you are living in the world and in this world, and you have to live with everybody, and it takes all kinds of people to make this world grow. You're going to have a great boss, you're going to have a terrible boss, You're going to have some bosses who are good in certain things, and we have to live with that. And if that becomes a source of stress instead of being a sort of motivation, then we're not going to move forward. Of course, you have to differentiate between toxic cultures, but that's a different topic altogether. Next slide, please. And it comes down to this, something that all of us know, but very few of us practice. We all know that diet is important. We all know that lifestyle is important. We all know that detoxes are important. We all know that smoking is bad. But how many of us actually practice? But if you look deeper and understand why you don't practice, it's because more often than not, the number of misconceptions that are there with all of this is a deterrent for a lot of people to start practicing this. Most commonly, I get asked, Doc, I love rice. I just don't want to give up rice. It's okay, I'm not well. And if I tell them, you don't have to give up rice, they're like, wait, what? Isn't rice unhealthy? I'm like, no, it's not. But I love ice cream. Eat ice cream. Can you actually do a detox and eat ice cream? Of course you can. Can you eat chocolates? Of course you can. Then what is this diet? That misconception is what probably deters people from taking that first step. The misconception that I have to give up so many of the things that I like. That's not true. Wellness is about balancing both. Surely you don't want to live to the age of 100 while not eating your favorite food, while not having your favorite drinks, and not traveling to your favorite places. Would you rather live till 80, 85 while doing all of this? That's the balance that wellness tries to find, is to understand what you like and how do we incorporate that into your life while staying well. Because if I take away your favorite food, trust me, I could put you into all the exercise in the world. You would have a fit body. Your mind is not going to be at peace. It's that misconception that we need to get rid of. Next slide, please. This is it. If you don't like the treadmill, it doesn't have to become a treadmill for you. It's important to understand that if you're extremely obese, for example, you start doing all these exercises, and in 5 years later, you've become trim and slim, and you probably delay diabetes by 5 years. But you know what? You might end up with arthritis because you took all that weight and pounded it on your knees. Now you prevented one disease and you ended up with something else. That's what wellness is again, is to understand that the aim is not to make you diet, exercise, and prevent something and put you into something else. It's not to prevent diabetes and end you with depression. It's that balance that we're trying to figure out here. Next. How similar does that look? I'm sure you've heard this before. But there are clues that we can take from nature. There are clues that we can take from religion. There are clues that we can take from ancient healing systems about how certain things work and how certain things don't. Yes, we are in the world of science, but remember that science has always taken clues from before. When I was doing medicine in 2000, diet and exercise wasn't such a big deal. But today we've taken that from alternative streams, we added the science component to it, and we made it mainstream. But 20 years ago, trust me, it wasn't. I'm sure Dr. Gayatri would agree that sometime back, diet and exercise wasn't probably even heard of for diabetes or for hypertension.
Not
It
when
came
I
not
was not when I was studying. Definitely not.
exactly. So were all the doctors wrong at that time? No. It's just that science is taking things from nature and proving it. And therefore, if something is not proven, it doesn't mean it's wrong. If something is proven to be harmful, then you have to avoid it. So that's the distinction we need to make. If somebody says, hey, this is not proven, don't worry. If it works for you, it doesn't matter if somebody else has proven it or not. If it's proven that it's dangerous, then you stay away. Next slide, please. It's another slide about nature's gift. Walnut is great for the brain. tomatoes are great for the heart. Let's not wait for somebody to prove that, because maybe 100 years down the line they will prove it scientifically. Because we have to differentiate again between science and statistics. Next slide, please. So, what then is the diet? Proportion of food is something that I'm very fond of. And that's something that I tell most of my patients, that no single food, and let me repeat that, no single food is good or bad on its own. It's the proportion that you eat with something else, it's the quantity that you eat, the timing of the food. It varies from person to person to person. I remember when my wife was pregnant, and she had gestational diabetes. When I told my obstetrician, let me take care of it, she's like, no, we have to get to a diabetologist. And they said, hey, this is not going to go away. You need insulin. Wife is like, no, I don't care what happens. I'm not taking shots. So I told her obstetrician, just leave it to me. They gave her a huge diet, no rice, chapatis, sugar just didn't come down. And so I intervened at some point and said, just leave it. Let's go back to your diet. We'll control it. With her favorite foods, rice, curd, pomegranates, fruits, we got the sugar back in control in about 15 days. Because again, when you're pregnant, there are a lot of hormones going around, a lot of hormonal changes, a lot of brain changes, a lot of your shifting between depression and elation. And the last thing you want to do is remove all your favorite foods. But if
Right.
you learn how to eat your favorite foods, instead of eating rice alone and trying and buying glycemic index controlled rice, eat the same amount of rice, quarter of that quantity with some vegetables. The glycemic index of the meal will come down. So then you don't need special rice, because that special rice is important. If you're eating only rice, if you're eating one anda rice and a small katori of vegetables, then obviously the glycemic index is high. But you take that much of rice and that much of vegetables, the vegetables will not allow the rice to be absorbed so fast. It's a small change in a diet pattern. But that way you can keep your favorite foods. Junk foods again. Sometimes the same junk food is packaged as healthy food and as junk food. If you have the time, sometime look at your favorite health drink, turn back and read what the nutrients are. And turn the back side of your favorite chocolate, Snickers, and read the ingredients are. You'll be surprised at how many ingredients are the same. Most of them will have milk solids. Most of them will have malt. Most of them will have some numbers, which means they don't want to tell you what it is. INS 456, ABC, XYZ, whatever. Or you'll probably tell me, hey, but that has vitamins and nutrients. So what? You can have a chocolate and a vitamin tablet, and it's the same as your health. So even junk foods, what are termed as junk foods, in the right proportion, at the right timings, are not too bad. So then you have to ask yourself, is it really healthy? Is something that is being positioned as a health food? Turn back, read the ingredients. You'll have the answer yourself. You don't need a doctor to tell you that. Something that I tell patients who come to me and say, Doc, I love biryani. Great. Diwali is coming. How do I resist a laddu? Why do you have to resist the laddu during Diwali? It's not that one laddu that's killing you. It's what you've eaten the rest of the year that's possibly causing all of those issues that you're going to have. So good food and good health can go hand in hand, and you don't have to give them all up. Next slide, please. Diet blunders. If you like something and you eat it, is very different from eating something because it's healthy. Now, fruit juices are a simple example of that. Sometimes I keep seeing with fruit juices saying no added sugar, no added preservatives. It's just juice in its purest form. It's a health food, so you can have it day to day. Let me tell you, you don't need to add sugar. You don't need to add preservatives. You squeeze the apple out and take all the sugar that is there in your juice. You don't need any preservatives. That is bad enough as it is. you'll probably get 100% organic certified diabetes. Why is that? Is because how many apples can you eat? If you take a simple apple juice for an example, how many apples can you eat? One, maybe two. I don't know if you can. But a glass of apple juice actually has the juice of 4 apples. Why are you able to drink a glass of juice in a gulp but unable to eat 4 apples? The fiber in the apple will make you feel full faster, will hit the satiety zones in your stomach, which are at the top part of your stomach, and make you feel full faster. It's a kind of a preventing you from overeating. You remove all the fiber, take all the sugar that's there in the juice and drink it. Why do you need extra sugar? But if you like apple juice and you drink it because you like it, then that's fine. You're doing it because then you know that this is not healthy, and you're doing it because you like it. But if you think this is healthy and you start drinking apple juice every day, then you're in trouble. Next slide, please. Superfoods. Again, remember what is superfood for Brazil need not be superfood for you. You don't need quinoa from Brazil imported or with all the carbon footprints, flown millions of miles away. Indian millets are just as healthy, if not more. Our horsetail millets are, in fact, we have more variety than most of this. Remember, what's healthy for somebody in Italy is not necessarily healthy for somebody in India. Again, I'm differentiating between healthy and what you like. You like pasta? Lovely, enjoy it. In 2017, when I was representing India for food in an Italian conference, I was actually, I literally had an egg on my face when I told my Italian friends, apparently you guys are, you have the healthiest food. Your olive oil is so healthy, and the Mediterranean food is supposed to be great. And she looked at me and said, "Hey, doc, did you consider how much of cheese we eat?" And then it struck me, oh my God, we've been talking about the olive oils, we've been talking about their salads, but they eat so much cheese. They're still healthy. So sometimes we take piecemeal from different cultures and say, hey, they're healthy because they're doing it, forgetting that they're doing a lot more things exactly the same way that we are doing. So what's healthy for one population is not necessarily healthy for somebody else. The climate, the weather, everything varies. Again, no harm in eating it whatever you like. It's the question of trying to eat it because it's healthy. So don't worry about getting quinoa. Get your Indian oxtail and every other millet that grows in India. It's just as healthy. I've seen the nutrients behind, the amount of protein, the carbohydrate, the ratio. They're very similar, and at 1/10 the price. Next slide, please. See again another example of something that wasn't proven till some time back. Today, our pranayama has been termed as cardiac coherence breathing by somebody. I kid you not. Somebody in the US, I think it was Cleveland Clinic, that has called this as cardiac coherence breathing as a technique. They tried to patent it before the outcry happened and said, hey, this is pranayama. Let's not wait for something to get proven. If it works for you, it works. Next slide, please. I don't have to tell you this, but smoking is something that has to go. If you feel the need to smoke, then there is something else. It's either a behavioral issue or your body's gotten used to the nicotine, and because of that, it's going to stock up on the tar in your lungs. There's no two ways about it. As part of a wellness, you you wouldn't need that thermal energy to keep you going through the day, if I could put it that way. Next slide. Next slide, please. This is just de-addiction tools. Yeah. So when people ask me if you do detoxes, does it actually help? The truth is, even without doing something like that, your body will heal. So if somebody's been smoking for about 10 years, approximately takes about 8 years for it to resolve, and about 3 years to reduce the risks to the same as that of a normal population. When people do healthy lifestyles, it actually resolves a lot faster. So it takes about, you have a 3-year advantage for your lungs to resolve back, and a 2-year advantage in trying to reduce your risk of getting a heart attack or cancer. So yes, it makes a difference when you actually give up smoking versus giving up smoking and doing something healthy uh, after you've given up smoking. Next slide. So this is another question that I get asked. Doc, I just took a master health checkup last week. Everything was normal. Let me tell you something. If you don't ask the right questions, you're not going to get the right answers. A master health check that was designed for typically about somebody in their 50s to rule out diabetes or hypertension. If a 33-year-old person or a 35-year-old person or a 42-year-old person takes it, everything is going to come out normal. So the normal expectation is that I'm not able to sleep, I'm not able to have a good sex life, I'm not able to, I feel bloated all the time. Something should be wrong with my blood results. No, that's not what it is. And even if something's wrong with your blood results, you need to ask the right questions. So for a younger person, tests like HSCRP, homocysteine, lipoprotein A, these have much more value than a simple regular master check. Also remember, a master check looks for current risks. A lifestyle health check, a risk analysis, looks for a future health risk. Now we have risk scores today like Reynolds and multiple risk scores that actually predict what is your risk of developing a heart attack in the next 5 to 10 years. Whether a smoker is going towards cancer or is going towards a heart attack. So there are ways to do it, and therefore it's important to ask the right questions. Sometimes just a master checkup is not enough. It's important to understand what tests are right for you, and and customizing that is the only way to get the right answers. Next slide. I'm sure you've heard about detoxes a lot. There are a lot of ways to do it. I'm not going to go into the details, but I'm happy to take questions on detox. Next slide, please. I think we're done. A couple of slides and we're done. Yeah, so this is just to understand the detox organs in your body: the lung, liver, kidney, spleen, large intestine, and skin. So these are the organs that are responsible either directly or indirectly for your detox. These organs being healthy is extremely important for your body to be able to detox on a regular basis. Next slide, please. There are various treatments. Over the last few years, the role of hyperbaric oxygen has been proven over and over again. What started off as a simple thing for decompression sickness, people actually found out there's a lot of things with hyperbaric oxygen. It works beautifully with anti-aging. It works beautifully with for post surgical treatments, for wound healing, for burns. There are different scopes for hyperbaric oxygen. It works even better for autistic children. So it helps to actually improve the brain performance. So this is something that's been around for the last 15, 18 years. It's catching up a lot more now. Next slide, please. Yeah, like I said, there are lots of foods in nature that helps with detox. Next slide, please. That's cinnamon, goji berries. These are all just things that we have at our home on a day-to-day basis. Nothing you need to put effort to get into. Turmeric is a brilliant detox food, and all of our kitchens have it. Next slide, please. Yep, no more gyan there. Next slide. This is something that I keep getting asked often: is that what is a healthy sexual life? Can you tap it? I think there's an animation there. What is a healthy sexual life? The healthy sexual life is when you feel that it's not healthy. That's when it's not healthy. Don't compare yourself to the neighbor and say, "Hey, somebody said they're doing it once a week. Should I do it once a month? 10 days of." There is no standard number. What works for you works. It's important that it works for both. Uh, as a couple, it works for both, and That is something that that is a very very important part of wellness, because sexual life, I mean, if you have to look into multiple ways, I don't want to get into details, but is one of the sources of energy for most of us. It's a natural requirement for the bodies. Everybody has a different need, and therefore having a happy and healthy sexual life is an extremely important part of well-being. Next slide, please. Yep, at the when you have a well body, your performances are better. Like I said, stress becomes a motivator. You feel a lot more energy inside. And most people, when they do things, make lifestyle changes, they come back and say, nothing outside has changed. My environment has not changed. My marriage has not changed. My boss has not changed, but I feel better. It makes you perform better. And that's what the goal of wellness is to make you feel at your best, so that you are able to go out and achieve the things that you want to achieve. That's my talk. I don't have more slides, but I'm happy to take questions. If I have not answered, or if I was not clear anywhere, please feel free to ask, and I'm happy to try and uh, solve the puzzle if you still have any.
Thank you very much, Dr. Wasim. Actually, your talk was very reassuring, I must say. And I like to
Thank
quote
you.
your professor, which I really liked, was that to get back to health, you must be sick and tired of being sick and tired. And I think that's a good clue. We have a lot of questions coming in, and
Okay.
I'm just going to take them one at a time.
Sure.
And one person says, I haven't had alcohol in more than 2 months, but
Mhm.
I am craving it now. Is there a way I can help this craving?
So alcohol craving and smoking de-addiction are, even though they're both de-addiction, they are extremely different ways of approaching them. Simply because alcohol's role and the way it operates in the body and brain is very different from the way smoking does. Because smoking has two components. It has the nicotine component, which is the addictive part, and the tar, which is the one actually causes cancer. But it's not the same with alcohol. It's one drug that causes both. So if you're craving alcohol, it's been 2 months. If you don't have any withdrawal symptoms, if you're not, when you say craving, are you craving mentally or are you craving physically? If you don't have any withdrawal symptoms, giving it up as it is probably the best way to do it. And this is a great way for self-control, because it's like a forced de-addiction. You don't have an option. If you do have withdrawal symptoms, there are ways to do it. There are small drugs that will take away the withdrawal symptoms. That's something that a doctor has to see you and prescribe. But something like disulfiram taken for a week can completely, get you kind of rid of the some of the withdrawal symptoms. So that's a little more technical.
Okay, so one more question is related. Is taking alcohol daily 3 to 4 pegs not worrying?
Not worrying is the question,
Worrying.
or
Yeah. I mean, is it worrying to take 3 to 4
Mhm.
pegs of alcohol a day?
Okay, so the internationally accepted number for both men and women is about 21 units of alcohol per week. So that is something that, depending on what alcohol you're taking, different drinks have different percentages. It's a very, very simple calculation. There are online calculators that tell you your particular wine has how many units. If you're crossing 21 units a week, then you fall into the risk category. Now, everybody has a different approach, different liver size. But what you need to understand is the problem with the liver is it's got such a huge capacity that till the entire liver is gone, you won't have symptoms. And when it's gone, it's too late for it to regenerate.
Right.
So most of the times, alcohol says, I've drunk so much of alcohol for 10 years, nothing happened, but now my liver is gone. This is the reason why. So it is worrying if you're crossing more than 21 units a week,
Okay.
and that
One
problems will come in much later.
Right. So the effects are seen much later. Right. So another question is, how many hours of sleep is ideal?
Again, varies from person to person, depending on their stress during the day. If you get anywhere about 7 hours of deep sleep, you're good enough. If you're able to get more than that, is great. Anything more than 9 is actually counterproductive. So it's better that you don't go more than 9 hours typically, unless you have specific requirements. So between 7 and 9 hours is great, but most people can do with about 6 hours. Anything less than 6 hours, you're putting yourself at risk for wellness issues.
Okay. Are there any detox drinks that we can have at home to energize and rejuvenate ourselves?
Okay, this detox is kind of a complex thing because you can't just drink one drink and get yourself detox. Let's get that out of our brains. It's not possible. Detox is a process. So there's no something saying that I drink honey and lemon is great, is good. It does a lot of good things for you, but it doesn't completely detoxify you. Detoxification is a process. It takes effort, it takes some time, and it is multifaceted. So you cannot just take a drink and say I'm detox. Detox consists of something that you have to take. You'll have to meditate. You'll have to do drainages, lymphatic drainages, oxygen. Uh, you know, it's a combination of things. So if somebody tells you you're going to this is a detox drink, it may have benefits, but it's not going to detoxify you. So it's equally important not to fall into scams.
Right, right, right. So there is one question about genetic tests. There are lots of talks nowadays about genetic tests. Are they really useful?
Again, it comes down to, are you asking the correct question? For why do you want to do a genetic test? Because we have more than 25,000 genes. You need to ask the right questions to get the right answers. One of the
Right.
good areas of genetic tests is for children, is for parents to understand, to give them an idea about what kind uh, of genes the children have. Is he somebody who can be a marathon runner, or can he be a sprinter? Does he have a sports gene? Can I put him in sports? It gives you an idea. It's not foolproof, but it gives you an idea. So somebody who has a very good fast mitochondria, for example, there's no point beating the child and making him do maths. He's not going to get it because his mitochondria is a lot slower. He would be a great marathon runner, but mathematics may not be in his gene. That's an area that works for kids. For adults, it's important. A lot of people come and say, what is my risk of diabetes besides my lifestyle and everything? Somebody who has a very high genetic risk of diabetes, it works for them to start looking after their health a little earlier than somebody who doesn't. So it gives you a lot of insights on how you can address your health. Another important area
Mm-hmm.
of genetics is nutrition. The amount of vitamin D that you need may be different from how much I need. That's why studies are not able to consistently show that vitamin D is important, because the genes are different. So if you take 10 people with different genes and say I put vitamin D for 10 of them, it worked only for 4, it's meaningless because it worked for the 4 for whom they needed more. So today genes can tell us if we need more vitamin A, if we need more vitamin K, more vitamin D, especially more iodine, more micronutrients. Do you need more magnesium? Do I need more magnesium? So for that areas, genetic tests actually play a role. But if you're going to think genetic test is going to give you all the answers for every question, not so much.
Okay. Another question has come in. Are high protein diets effective for weight loss?
Okay, so let me kind of bust a myth. No single diet works for everybody. Weight loss is a combination of being persistent, of understanding your system, of getting into some kind of a energy negative role for a while. Proteins are also calories. Now, where protein comes into play is to prevent muscle loss. So when you decide to do weight loss, because maple syrup diet worked for Beyonce, it doesn't mean it's going to work for you. Because high protein diet worked for Kohli, it may not work for you because his lifestyle is different, his training is different. So the question should not be, do high protein diet weight works for weight loss? How do I do the high protein diet correctly so that it will work for me? When that question gets turned like that, you will be able to find better answers, because a high protein diet may work for me, may not work for you.
Right. Um, okay. There's somebody who's asking, about their grandmother who has difficulty going to sleep, and once asleep, she wakes up frequently. What can I advise her to improve her sleep?
So as we age, our muscles start to get a little weak. So if she's snoring, then there's a very high chance that she might have some degree of what is called as a obstructive sleep apnea, which means that the muscles are weak, so it collapses, and so she needs to wake up to take the breath again. So one of the simplest ways to solve that is to sleep on the side, because then it'll keep the airway open. So I don't know what her age is. Somebody beyond the age of 80, then it's a completely different paradigm. Wellness doesn't apply there. Uh, but the simplest form of solving an OSA is to sleep on the side.
Okay. There's another general question. When should someone reach out to a doctor for a sexual problem?
Is when he or she believes that this is a sexual problem, because sexual problem is such a wide range and it varies very differently from men and women. So for men, it can be because of interest. That's when the libido is down. So then when that happens, it's usually the partner who starts to complain. But if the libido is not down, then if they're able to get it up, if they're able to maintain, if there is an orgasm, so that it's a complete cycle. For women, it's very different. The libido issues are similar, but beyond that, there's issues with pain. There are issues with there are a lot of times some form of PTSD is extremely common in sexual health. So if you think there's a problem, then it's better to reach out, because solving that will solve a lot more issues.
Right. Thank you. Dr. Wasim, you spoke about fruit versus fruit juices. My question is fruit juices always bad?
No, like I said, no single food is good or bad by on its own. If you like fruit juices because you like fruit juices, they're fine. But if you start drinking fruit juices every morning because you think they're healthy, then you're going to overload your system with fruit juices, and that's when they become bad. If you're going to a buffet and you're going to drink fruit juice, it doesn't matter, because remember, the foods that we eat at home are the ones that either keep us healthy or kill us, because that's the food that we eat most. So the nourishing meals are the ones that have to be healthy. Your indulgences can be anything.
Right. Right. So, we've had a lot of questions, and the questions are, they're continuing now. But there's a time limit for this broadcast, so I will have to wind up now. So I'm just going to, ask people, that those who would like to get in touch with Dr. Wasim and get more information, would like to consult with him, please get in touch with Health Travelers Worldwide on their Facebook page or on the numbers, which you can see in your screen, and they will help you get a consultation with Dr. Wasim. I would like to conclude today's live session by thanking Dr. Wasim for tackling such important topics so relevant in these times, and for your excellent presentation, and for answering the many questions that came in.
Thank you, ma'am.
I thanked Health Travelers Worldwide for initiating the knowledge sharing series. It's a great initiative, and I'm glad to be a part of it. This organization also is running a voluntary virtual clinic program, in which there's a panel of expert and very senior doctors who are giving up their time, volunteering their time, and during this lockdown period, and giving consultations to people mainly from the northeast of India and Bhutan. So if there are any queries that you have, please contact them with your medical queries for a teleconsultation. The knowledge sharing series will be conducted every Saturday at 4 p.m. And we hope to engage with experts and doctors to address various relevant and important topics. And I hope you will like, share, and follow the Health Travelers Worldwide Facebook page. Thank you very much, Dr. Wasim. It was a pleasure speaking to you. Thank you.
Same here.